Hello and welcome to In Case You Missed It. So, providers and hospitals are the latest to be asked to come up to the Hill and testify in front of House Republicans as they continue their PR campaign on making the American public feel like there is something happening with healthcare pricing and affordability. Really, it's just a bunch of talking and finger waving. So, the health insurance and pharmaceutical businesses and CEOs testified in January and February. And for the hospital association provider groups, the temperature was noticeably lower than it was for the insurers. So overall spending on hospitals represents more than half of the nation's healthcare spending, and it's growing much faster than regular health spending overall. Regulators are mostly concerned with mergers and acquisitions among providers. It's speeding up at an alarming rate, and hospitals are incentivized to purchase outpatient facilities because the way it works is when a hospital or an outpatient facility bill for an MRI or a Band-Aid, they're very different reimbursement levels from Medicare, from insurance companies. So when the hospital purchases the outpatient facility, they are able to start running the charges through the hospital system and get reimbursed a lot more for the same services. One of the legislators on the panel called hospital pricing utterly irrational. It's not related to quality, it's not related to safety. It's basically whatever the hospital can get away with charging, end quote. So we'll see if there's any action on that. Unlikely. More legislation hitting the Hill. My National Association of Benefits and Insurance Professionals has proposed the Patients Deserve Price Tags Act. It's Senate Bill 2355 and House Bill 5582. It would establish enforceable standardized healthcare pricing transparency across all providers. So the bill requires publishing monthly machine readable files detailing gross charges, discounted cash prices, payer specific negotiated rates, and the methodologies used to calculate those rates. There is also the Healthy Competition for Better Care Act, which is aimed at improving competition in healthcare and banning several types of anti-competitive contracts between insurers and providers. So more action on the Hill around healthcare transparency, pricing, competition. Expect this to be continuing all year long into the new year. Speaking of healthcare legislation, there's a new framework released in March this month by Senate Democrats led by Senator Ron Wyden. And what we're seeing here is Democrats feeling very confident that they're going to win the midterm elections and to come into more power. So their goal is to start building ideas on legislation, getting some consensus from the left on things like limiting out-of-pocket costs and deductibles, more federal rules on insurers, stronger regulations of pharmacy benefit managers and drug pricing, expanded ACA-style subsidies and protections, and push for stronger government role, but not single payer quite yet. There's two factions in the Democratic Party: the more conservative Democrats, which want to reform private insurance. This is Senator Wyden and the moderates, and then there's the Bernie Sanders wing, which want to replace everything, throw it all out, and go single payer. What this really means is more regulations on employer plans, more reporting from employers, more mandates, and really more shift of the costs and responsibilities away from the government and onto employers. Health and Human Services is investigating 13 states for coercing healthcare providers to provide abortions. So on Thursday, they announced that these 13 states, California, Colorado, Delaware, Illinois, Maine, Maryland, Massachusetts, Minnesota, New Jersey, New York, Oregon, Vermont, Washington, 13 states, all of them mostly blue. There was no complaints that prompted this investigation. Rather, this administration is going after these states, trying to claim that they are making providers give abortions when they have now outlawed a lot of that kind of stuff. So feels a little political as usual. So there's more politics, less policy coming through here. But we'll keep an eye on that. Robert F. Kennedy Jr.'s vaccine agenda takes a major blow, just a big Mike Tyson uppercut to the chin. A court ruling on Monday dealt a heavy blow to HHS Secretary RFK Jr. His efforts to transform America's vaccine policy. Basically, U.S. District Judge Brian Murphy granted a preliminary injunction on the reduced childhood immunization schedule Kennedy issued at the start of this year, as well as the appointment of more than a dozen new members to the Vaccine Advisory Committee, most of which don't have vaccine experience, some of which aren't even doctors. In one fell swoop, the ruling effectively nullified all the recommendations that this panel has come up with, and it canceled all the upcoming meetings and undid all of Kennedy's sweeping vaccine policy changes over the past year. So everything you've heard on vaccines is come to a grinding halt with this injunction. And finally, you're going to hear a ton on federal healthcare policy in 2026, especially if Democrats come into power. We're going to see Medicare and Medicaid funding changes, telehealth extensions, ACA subsidy changes affecting premiums, drug pricing and PBM legislation, and new guidance from CMS on payment rules. So we are going to have a lot to talk about in these Friday videos. See you next week.